Welcome to ETMC TV and this informative presentation by podiatrist and board-certified foot surgeon Robert A. Boudreau, DPM. Dr. Boudreau will discuss the diabetic foot. Thank you for choosing ETMC TV.
Diabetes is by far the most common medical condition that I see that affects the foot. Among U.S. residents aged 65 and older, 10.9 million people, or 26.9%, had diabetes in 2010. About 215,000 people younger than age 20 had diabetes, either type 1 or type 2, in the United States in the same year. Also, more than 60% of the amputations which occur to the foot or lower extremity are directly attributable to diabetes or its complications. Statistics have shown that once a diabetic has a first amputation, the chances for a second amputation within 1 year are very high. After 5 years, the mortality rate is significantly increased after that first amputation. Diabetes specifically affects the foot through two different areas, the vascular circulatory system or the neurological system. Through the vascular complications, we notice that poor healing, no healing, sometimes gangrene even sets in, and if you have poor circulation, you are at increased risk of getting an infection. In the neurological aspect, we see that diabetes affects people through the diabetic peripheral neuropathy. We call this LOPS, L-O-P-S, loss of protective sensation. As a diabetic progresses in their disease, many times they will develop sensory loss in their feet. Diabetic peripheral neuropathy can also lead to diabetic ulcerations. These are a common problem that we see in diabetics because they don't have the sensation to tell them they're having a problem. We want to see our patients once they are first diagnosed. Even if they're not having a foot problem, this allows us to establish a baseline for future examinations. In our office, we have a list of instructions that we give to each diabetic patient on each visit. Our first instruction is to inspect your feet daily for any cuts or blisters or sores, and you can use a mirror to help you in looking at that. If they have a cut or an open sore or an infection, that can turn into a major limb or life-threatening problem within a matter of hours or days. Number two, if their vision is impaired and they can't even see the mirror, I suggest that they either have a family member or a caretaker inspect their feet. Number three, they need to wash their feet daily. I know this sounds like a very simplistic instruction, but one of the main things in preventing problems and infections with a diabetic foot is just to keep them clean. Wash in between their toes, dry in between their toes very carefully. Number four, they need to change their stockings and or their socks on a daily basis. Number five, we recommend that they don't cut their nails, corns, or calluses unless given special instructions. This prevents them from causing infections or cuts or sores from happening. Number six, I always ask them to look at their shoes before they put them on. We recommend that when you purchase shoes, go in the afternoon. If you have your feet measured in the morning, if it swells in the afternoon, the shoes will be too tight on your feet. Number seven, we ask that they notify their podiatrist immediately if they develop any of these problems, blisters, sores, cuts on their feet. Immediate, early treatment is the best prevention. They should also avoid any extremes in temperature. For that reason, we don't like for them to soak their feet, especially in hot water. If a patient is neuropathic and they cannot feel, how do they know how hot the water is? I also recommend that the diabetics see not only their physician on a regular basis, that they see their podiatrist on a regular basis. Some diabetics that have no foot complications can come and see me once a year for their annual examination. We can compare it to the previous examination and note any changes. Many times though, we see diabetics back on a 2-week, 3-week, 1 month, 2 month, depending on their state of problem that they're having. The last thing I want to talk about is if you smoke, please try to either cease or slow down on the smoking, because smoking prevents oxygen from getting to your feet. And with the circulatory problems that diabetics can experience, all of the oxygen needs to get down there that we can have getting down there. So if you can stop or at least cut back significantly, your feet will benefit from that.
Dr. Robert Boudreau treats patients at the ETMC First Physicians clinics in Tyler and in Gun Barrel City.
I went to San Francisco to the California College of Podiatric Medicine and attended there from 1979 to 83. Did my residency in foot surgery at the Waco Veterans Administration Hospital.